Good morning. Myself, Dr. Vishwa Raj Lal, Faculty of Biotechnology, Jamshedpur Women's College, Jamshedpur. Today, we will discuss about leukocytes or white blood corpuscle. In this, we will discuss introductions, different types of leukocytes present in the blood, granulocytes, and total leukocyte count, structure and function of various leukocytes. WBC or leukocytes are an important part of the immune system. These cells help fight infections by attacking bacteria, virus, and germs that invade the body. WBC cells originates in the bone marrow but circulate throughout the bloodstream. There are 5 major types of white blood cells: neutrophils, lymphocytes, eosinophils, monocytes, and basophils. So this is the different types of leukocytes present in the bloods are granulocytes, percentage, number present. First, granulocytes have granules in their cytoplasm. They are of following 3 types: basophils, acidophils, neutrophils. Basophils less than 1% in percentage and number present 10 to 100 ml of blood. Acidophils 1 to 4% percentage and 150 to 300 per ml of blood. Neutrophils 50 to 70%, 3000 to 6000 per ml of blood. In second, granulocytes do not have granules in their cytoplasm. They are of the following 2 types: lymphocytes and monocytes. Lymphocytes 20 to 40%, 1500 to 2700 per ml of blood. Monocytes 2 to 8% and 300 to 600 ml of blood. Total leukocytes count TLC at birth is 20,000 per ml of blood, but soon their number decrease. In adults, TLC is 4,000 to 11,000 per ml of blood. In leukopenia, TLC becomes less than 4,000 per ml of blood. In leukemia or leukocytosis, TLC increase above 11,000 per ml of blood. Leukemia is a cancerous condition of blood where TLC is usually more than 50,000 per ml of blood and associated with immature WBC present in the blood. Leukocytes or white blood cells, corpuscles, are characterized by absence of hemoglobin, bigger in size than RBC, presence of nucleus, showing amoeboid movements, number in much less than RBC, much shorter lifespan. Next, we come to a structure and functions of various leukocytes. First is neutrophils or polymorphonuclear leukocytes. Second, acidophils or eosinophils. Third, basophils. And fourth, lymphocytes and monocytes. Neutrophils or polymorphonuclear leukocytes, they are 10 to 14 micrometer in diameter. Their nucleus is multilobed, are called as polymorphonuclear leukocytes. However, the young cells have horseshoe shaped nucleus. As the cells grow older, the nucleus becomes multilobed. More the number of lobes, more mature in the neutrophils. The lobes of the nucleus are connected by chromatin threads. The granules in the cytoplasm are neutrophilic in nature, that is, they are stained both by acidic and basic stains. As the granules contains various enzymes like glycosidase, sulfatase, phosphatase, nuclease, and other proteolytic enzymes. So these granules can be compared to lysosomes. These granules are also known to liberate histamine and peroxidase enzymes, which helps to kill the ingested bacteria. The main function of neutrophils is phagocytosis. They are the first cells in the body that ingest and kill bacteria. They also contain fever-producing substance, endogenous pyrogens. An increase in the number of neutrophils is known as neutrophilia. and a decrease in the number of neutrophils is neutropenia. Next, acidophils and eosinophils. They are 10 to 14 micrometer in diameter. Most of the acidophils, 85%, have bilobed nucleus, while a few, 15% approximately, have a trilobed nucleus. Their cytoplasm has coarse granules which are stained red with acidic dyes. These granules do not cover the nucleus. These granules contain histamine and enzymes that are found in the neutrophils. These cells are less motile than neutrophils, so they perform mild phagocytosis. Eosinophils attack parasites that are too large to be engulfed by phagocytosis. They release chemicals which are toxic to the larva of parasites. They also enter the various tissues like respiratory tract, gastrointestinal and urinary tract, to which they probably provide mucosal immunity. As increase in the number of eosinophils is known as eosinophilia, while a decrease in their number is eosinopenia. Next, basophils. They are also 10 to 14 micrometer in diameter. Nucleus is a lobed structure. Their cytoplasm is granular and basophilic, that is, it is stained blue or purple with basic stains. Granules are numerous and overcrowded the nucleus. The granules contain histamine and heparin which they liberate. They also do mild phagocytosis. As increase in the number of basophils is called basophilia, while decrease in basophils is basopenia. Next, lymphocytes are of two types: large lymphocytes 10 to 14 micrometer diameter and small lymphocytes 7 to 10 micrometer diameter. Large lymphocytes are the precursors of small lymphocyte. Both of them are responsible for antibody production. Both have a single and large oval shaped nucleus. The nucleus is central in position and occupies almost whole of the cell, leaving a small cytoplasm at one end or all around it. The cytoplasm is pale yellow and scanty. Its amount is always less than the amount of nucleus. These are of two types of lymphocytes: B lymphocytes 20 to 30%, which survive for few days only, and T lymphocytes 60 to 80%, which survive for 2 to 4 years. As increase in the number of lymphocytes is lymphocytosis, while a decrease in the number of lymphocytes is lymphopenia. And lastly, monocytes. They are the large WBC having 10 to 18 micrometer diameter with irregular cell outline. They have a single round or kidney shaped nucleus. The nucleus is eccentric in position, that is present on one side of the cell. Cytoplasm is clear and pale blue. Sometimes it contains purple dust like granules called azure granules. Monocysts also perform active phagocytosis. Monocysts follow neutrophils in the area of infections or inflammations. However, the mechanism of phagocytosis is similar to that of neutrophils. Monocyst also kills tumor cells after sensitizations by lymphocytes. Monocysts enter the circulations from bone marrow but after 24 hours they enter the tissues to become tissue macrophage. All the tissue macrophages come from circulating monocysts. An increase in the number of monocytes is monocytosis, while their decrease is called monocytopenia. So this is all about leukocytes or white blood corpuscles. Thank you.